Good afternoon and welcome to the Chancellor's Live Update. I'm Dr. Spencer Gregg, Director of the Student Health Center here on campus, and I'm pleased to be with you today. As you can see, Chancellor Plowman can't be with us today, so she's asked me to step in and provide you with our latest campus update. I'd like to start by saying that we greatly appreciate everyone following our on-campus policy regarding wearing their masks indoors. We're witnessing more of those on campus adhering to that policy, which helps us reduce the potential for viral transmission, and we're greatly appreciative of that. We also want to express our appreciation to those who've elected to receive their vaccine. We continue to see an increase in the number of people on campus and in the greater Knoxville community getting the vaccine, and that too is excellent news. In fact, just yesterday at the Student Health Center, we administered right at 100 additional vaccine doses. At this time, I'd like to go over a snapshot of our on-campus COVID data. As a reminder, you can find the latest data about our active COVID cases and the number of those who've reached out to our COVID support team on our website at utk.edu/coronavirus. That's utk.edu/coronavirus. And to be clear, we have returned to updating this data each weekday. So by the end of yesterday, we had 167 active positive cases. 25 were employees and 142 were students. Fortunately, cases have been trending down on campus, but we've got to remain diligent. Our broader Knoxville community is continuing to see a significant spread, especially among children and young adults. Some doctors' offices, walk-in clinics, emergency rooms, and emergency response teams are experiencing a higher volume of those seeking care and testing, resulting in delays and long wait times. Rapid COVID tests are temporarily experiencing a supply issue nationwide, and the CDC has requested their judicious clinical use to offset this supply issue. Our local hospitals, including UT Medical Center, continue to see a large influx of patients, particularly those unvaccinated with COVID symptoms. The compilation of these issues contributes to a general strain on our local healthcare system. For example, at one point earlier this week, according to local media, only 6 ICU beds were available across all of East Tennessee. In the bigger picture, all of this means that it's not only potentially difficult for those with severe cases of COVID to access care, but even patients with other serious and complex medical issues may also be experiencing difficulty accessing the care that they need. And this is why it's so essential for us to do what we can to help reduce the spread of illness. Vaccinating our community is our best path forward. Let me say that again. Vaccinating our community is our best path forward. So I urge you, if you haven't already done so, get vaccinated. The vaccine is safe, it's effective, and it's free. It not only helps to reduce your risk of severe infection and hospitalization, but it also helps protect others. And speaking of vaccinations, you may have questions about President Biden's announcement last week that large private employers and federal employers and contractors must require vaccination or weekly COVID testing. Well, we too have questions, and campus leaders are working with the UT system to understand how these executive orders impact us here at UT Knoxville. We certainly expect to have more detailed information soon, and we'll share that with you as soon as it becomes available. Fortunately, however, as we've already noted, we're seeing vaccination rates increase. So I encourage you, get your vaccine if you've not done so already. The Moderna and J&J vaccines are readily available here on campus through the UT Student Health Center Pharmacy. They're available not only for faculty, staff, and students, but also for members of the general public. You can schedule an appointment for the vaccine at the Student Health Center Pharmacy through our COVID website. Again, that's utk.edu/coronavirus, utk.edu/coronavirus. Community-wide, retail sites for vaccination with the Moderna, J&J, and the recently FDA-approved Pfizer vaccine are also available. Many of those are right next to campus. Finally, I want to remind you that if you've potentially been exposed to the virus, whether vaccinated or unvaccinated, it's important to get tested to help prevent its spread. Talk with your healthcare provider to see when you should get tested. If you're a UT student or employee exposed to the virus and experiencing symptoms, please stay home. Contact your healthcare provider and complete a COVID support form. This form is how we know that you need resources and help and make sure that you get it. The form is available at our COVID website. I also encourage you to visit our Student Health Center website for additional information at studenthealth.utk.edu. Again, that's student health, that's all one word, studenthealth.utk.edu. On that website, we've posted links to the COVID support form, but in addition, there's helpful information regarding things that you can do to help while you're sick, scheduling information regarding COVID-19 vaccines, as well as the availability and scheduling for COVID testing and obtaining your test results. In closing, I want to encourage you to play it safe. Get your vaccine for your health as well as that of others. Stay home if you're sick, and as possible, maintain a healthy distance from those outside of your household. Wear your mask while indoors, regardless of your vaccination status, and even consider wearing it outdoors if you happen to be in a significantly crowded situation. Wash your hands or use hand sanitizer regularly, and keep frequently touched surfaces clean. All of these measures can go a long way in keeping you and others safe. Thank you for spending time with us today. I appreciate the opportunity to talk with you about these matters of such importance. Chancellor Plowman will be back for the next live update in 2 weeks. I wish you a great rest of the week, and go Vols.